I'm Dr. John Lundgren. I want to talk to you about what you can expect following your root canal. Each tooth is different and each case is different, but let's divide root canals into 3 categories. The first type of case is when your tooth is irreversibly inflamed. This tooth is the hot tooth. You drink cold and the tooth feels like it is on fire and the pain lingers for a long time after you remove the cold. This tooth is also very tender to bite and pressure, and the darn tooth won't let you sleep at night. In fact, it feels like your heart is in the tooth. When a patient comes to our office with these symptoms, I'm smiling because this is usually the tooth that we can make feel 90 to 95% better immediately. This case usually requires no antibiotics post-operatively. We give these patients a combination of ibuprofen and Tylenol and have them take it every 6 hours for the first full day. Once the numbness from the local anesthesia wears off, the patient will notice that cold will no longer cause discomfort. The tooth may be slightly tender to chewing for 3 to 7 days. Make sure you see your general dentist and have them permanently restore this tooth within 30 days of your root canal. The second case involves infection. This tooth may have a deep ache or throbbing pain, or it may have no pain at all. Many times we will see an abscess on an x-ray. This tooth is dead and has no sensitivity to hot or cold foods. There are millions of bacteria inside the tooth, and the tooth is dead. This case is a little more complex than the inflamed tooth. An infection may have to be managed, and we may have to place medicine called calcium hydroxide in the tooth for 1 to 3 weeks, or we may be able to complete the root canal in one appointment. We are the tooth whisperers, and we always listen to the tooth. The tooth will tell us what to do. Whether it is a 1 or 2 appointment case, the post-op symptoms after the first appointment can vary. You can have 0 pain, or you can have any degree of tenderness that will usually peak at 72 hours, 3 days, and last for a week. After treatment, we will usually prescribe an antibiotic and a stronger pain medicine. The third type of case involves infection and swelling. This is a more serious case and requires management of this case. Here you may experience more severe pain and throbbing. The infection has spread to your soft tissues in the gums or fascial spaces. This is more serious and requires us to start the root canal immediately by placing a medicine called calcium hydroxide within the tooth for 1 to 3 weeks under a temporary filling. If the swelling is significant, it may need to be drained via an incision and drainage procedure. Most of the time, starting a root canal and placing the patient on an antibiotic will be sufficient. Following this appointment, the patient can feel immediate relief or have significant discomfort for 3 to 7 days. Antibiotics and pain medicines are usually recommended. One thing to remember about pain: any medical or dental procedure that involves tissue injury or insult, such as a cut, a bruise, or root canal, may have a peak inflammatory response 72 hours after the tissue injury. So don't be alarmed if you experience post-op discomfort 72 hours following a root canal. If this happens and you are concerned, please call our office.